Okay, now let's look at some sample documentation. You know the saying that if it was not documented, it was not done. Your documentation is what covers you. That's what shows that you did your work. And there's a lot of different types of documentation. The common one is when you give medication. So let's look at example of the Dilantin. You give medication, the resident take the medication, you put your initial. So here on the 10th, remember when we did the MAR, when we prepared the MAR, there was no signature yet. There was nothing signed. So let's just start with the 10th now. So let's say you're the one that worked on the 10th, at 5 p.m. You gave the Dilantin as ordered, 200 milligrams of Dilantin, and resident took the medication, and then you would just put your initial here. I'm going to pretend to be Donald Trump, and my initials are DT. So here on the evening of 10th of April at 5 p.m. resident took the medication, and I put DT here. And also the next example where it was a blood pressure medication and there was instruction to take the blood pressure first before determining whether to administer the medication or not. So at 5 p.m. I took the blood pressure and I got 116/60. So I put my 116/60 in front of the BP for 5 p.m. and then I put my initial here and I circle. See the difference here? The first medication, I just put DT, my initial. The second one, that's when they take it. When they don't take the medication, you circle. In this one is not a refusal. You don't have to write anything. You don't have to call your charge nurse. You're actually carrying out the order exactly how you're supposed to. And the blood pressure here is quite normal. So there's nothing abnormal about it. So you don't have to call your charge nurse. If this was a refusal, let's say you go in and the resident says, no, I don't want you to take my blood pressure. Then that would be a refusal because you wouldn't give the medication not knowing what the blood pressure is. So that's how you would sign that. And then I'm going to come back to the next day and give other type of example. So let's just stay on the 10th now. And then let's say on the 10th, that same 10th at about 5 p.m., resident came to you and said, nurse, I have a fever. All right. You know there is a order for the resident to take Motrin 400 milligrams. So you would take the temperature, and then I took the temperature at that 5 p.m. and I got 101 on the thermometer reading, 101 degrees. So how would I sign after giving the medication? So here it will be, remember, there is no schedule for the PRN. It's just only when needed. You put the time when you sign. That's the difference between the PRN signature and the routine signature. So here it will be three things: your initial, DT, the time medication was given, 5 p.m., and why. So the temperature was 101. Then I put 101 there to show that it was because of the temperature of 101. That's why the as needed Motrin was given. On the next day, I gave an example of a pain. So if resident had come to you and say he had pain, you would ask the resident on a scale of 1 to 10, how bad is your pain? He says 8. So when you give the Motrin, you're going to sign your initial, the time. This is assuming that it's the 11th, okay? And then the purpose here will be different because the previous day he had fever of 101. This time is for pain. And he says his pain level is 8. So you put P8 here to indicate pain level of 8. All right. And then there's additional documentation. Because this is now a sickness, is a change, is a problem, you are going to report this to your charge nurse. And I'm going to show you a sample, different sample documentations when we get to that sheet there. Then I also showed you how you would sign for the ampicillin. That's just simple. It's scheduled, so you just put your initial there, okay? And next one would be the insulin. So on the 10th, following the insulin order, I checked the blood sugar at 5 p.m. The blood sugar was 132. That means it is higher than 120. It's between 120 and 400, and doctor had said to give the insulin if the blood sugar is between 120 and 400. So I gave the insulin. I gave the insulin on the left arm. So I signed DT. I put the result of the blood sugar, and then site I put LA, assuming that that's the underarm, not on the shoulder, assuming that your MAR does not have the code where you can put 1, 2, 3 representing the different sites like we have on top of the MAR right here. So you know we have injection sites. We have injection sites, and you can put the numbers if your MAR have that. If your MAR does not have that, then you can put RT for right thigh, LA for left arm, stuff like that. And then I showed you an example of the next day. Let's start from the bottom now. The next day, when the blood sugar was checked at 7 a.m., the result was 110, which is below the 120. So you would put your initial, put your blood sugar result, which is 110, and there's no insulin needed here. So you just put 0 for site. That means there was no insulin given. And we already talked about this on the 11th. That's the pain. And then here's an example of the blood pressure medication the next day. The previous day, the blood pressure was below, the systolic blood pressure was below 120. But the next morning, we had 130/74. So you just write the blood pressure result and then put your initial DT, which is my initial. I am plain Donald Trump. Here, so let's do an example of a refusal, and then we will go to the other types of the additional documentation that you have to do when there's a problem. For example, if they refuse their medication, that's a problem, that's a change. They have pain or fever, that's a problem, that's new, that's a change. You have to report that. So here, remember, a circle around your initial means that the resident did not take the medication. but it does not say why. Okay, so what you're gonna do is, the way our MAR is designed. You're gonna turn to the back of the MAR, and you're going to put a comment. You're going to put a comment. Okay, let's see here. There is let's try to zoom in so you can see. On the back of the MAR has like date and time and initial. I don't know if you see that. And then there's a section for comment. Okay, so resident refused Dilantin at 8 a.m. on the 11th. Again, I mentioned that you should always persuade them, go back again, try to offer it to them a different time. Wait, you can wait 15 minutes and try again. All right, but if you try and they still refuse, then you're going to circle, initial and circle, then turn to the back of the MAR and put your explain the reason why you circle the medication. In this case, resident refused Dilantin. Just simple. If the resident was not home, maybe resident went to doctor's appointment and wasn't back yet when the medication was due to be given, then you would circle, and then on the back here you would say resident not back from doctor's appointment. Simple. Or family came and took him out shopping and they haven't brought him back yet in time for his medication. So you would put here resident out with family, not back at 5 p.m. or at 8 a.m. depending on the time. Then you're going to go to the progress note, the nurse's note, and write additional information, because the next thing to do will be to call your charge nurse and inform him or her that the resident did not take the Dilantin. But before we go there, let me show you something on the back of the MAR that you must do on every MAR. So when you put your initial in front and sign the medication that you're giving, well, they don't know who DT is or what DT stands for. On the back of the MAR, there's space that is provided to spell out your initials. You only do this one time, so you leave these other spaces for other people to also put in, what their initial stands for. So throughout the month, whenever they see DT that worked or gave medication, they know that means Donald Trump. So you put DT, Donald Trump, and your title, CMT. Not your PhD, not your law, not your chieftaincy title. So just the CMT, the title that gives you the right to give medication. So that's how you would record medication when you administer medication on the MAR. That's how you record the MAR. Let me just show you something here. I know this came up before. This is a pain assessment tool for people who are not able to speak. For example, let's say your resident cannot talk. Because whenever you give pain medication, you have to indicate in your documentation what was the severity of the pain. So if the person can talk, you would ask them on a scale of 1 to 10, what is the severity of your pain? They will say 5 or 10 or 6 or whatever. But what if the person cannot speak? So then you are going to look at the person's facial expression and try to estimate the level of pain. So here they give you pictures to kind of guide you. If the person is smiling, then that means that they have zero pain. Okay. Right here, 1 and 2 hurts a little bit, 2 to 4 a little bit more, 3 to 6 hurts a little more. Right here, number 4, 4 to 8 hurts a whole lot. And then if they are crying, then that could be anything between 5 and 10. That means the pain is crucial. The pain is at a level of 10 if they are crying. So you would give them their medication or call the charge nurse to get an order to give medication. So just wanted to show you that the rest of the back of the MAR. Well, of course, not all MARs are the same, so you might not have all this information in the MAR that you're using. Now let's go to the progress notes. Here we're going to have we have several examples of documentation that depending on the situation. So let's start from the top here. You will find this document in your resident's medical record. There's a section in the medical record that will say progress note. So here, facility name will be on it. Greenbelt Assisted Living LLC is the facility name. Fictitious facility name. Hopefully we'll open one soon, but that's for later. So here the patient name or resident name or client name is Raymond Umar. The first example that we have here, this is just like a sample of how you write a report on the progress note. So here, this is when the resident on the 10th of April 2020, the resident had a fever of 101. You confirmed the fever by taking the temperature, it was 101, and you gave the Motrin. You sign on the MAR. I don't know if you remember. Let me show you what I'm talking about. I remember when we had the Motrin here on the 10th, and we had a temperature of 101. So then what you would do after that would be to call the charge nurse and inform the charge nurse that the resident had a fever, because that's a sickness, that's something. Remember your non-medical emergency category of reporting. It's not an emergency, it's a non-medical emergency. So you call your charge nurse and let her know that the resident or him that the resident had a fever of 101. When you get off the phone, you have to document that you did report the problem in case something bad happens later on. They're going to say you never reported the problem to your charge nurse. So you get off the phone, and then you're going to come to this progress note or communication note, and then you're going to basically write what happened. So at 5 p.m. on April 10th, resident had a fever. Forgive my writing if it's confusing, but that's a fever. Resident had a fever of 101. That's what happened. So now what did you do? Motrin 400 milligram given. Okay. What else did you do? Delegating nurse made aware. So you reported it. Okay. Did he give any instruction? Yes, he did. Gave instruction to recheck temperature at 6 p.m. So you're going to write down what happened, what you did, who you reported to, and what did they say. Short and simple. When you finish writing, you are going to sign your note. So let's say you didn't have enough room here. I didn't have enough room here to put You know how Donald Trump signs a long signature. So it wasn't a long enough room here. So I crossed that out so that somebody will not come add something to your note. Remember, this is all legal documents. If there's a problem and there's a lawsuit, they're going to want all these documents in court. So so I put a line there, and then I did a line on the next line, and then to where I know I'm going to have enough space to sign my name and my title. So I put Donald Trump CMT. Now remember, there was instruction to recheck temperature at 6 p.m. Okay, so 6 p.m. comes. Usually you give the medication time to work, and then resident had a fever of 101 at 5 p.m. and then at 6 p.m. you want to go back and check and see if the medication achieve desired effects. Remember desired effects? That's where, you know, there's a problem. You give medication, the problem goes away. So at 6 p.m. you recheck the temperature. So the temperature, hypothetically here, the example that we're using, temperature was 98.9. So the fever came down, the medication did work. All right, problem solved. But you have to call the charge nurse back to let him or her know that you did recheck the temperature as you were instructed to do, and then the result was 98.9. So you put your entry here after you get off the phone. Resident temperature was rechecked. Result was 98.9. Nurse David made aware. No further instruction given. You sign. Case closed. Okay. So that's just like an example of a refusal documentation. The next example is a refusal. Again, let me take you back to the MAR. If you remember, we had an example here where the resident refused Dilantin. The 8 a.m. dose on the 11th was refused. Okay, I'm going to explain the rest of what I have there so that you don't get confused. I'm going to come back to the discontinuation and then explain that. But I'm just showing you documentation for refusal. So 8 a.m. on the 11th, you went to give Mr. Raymond his Dilantin for seizure, and he refused. You tried and tried a few times, and he still refused. So you have no choice but to document that Mr. Raymond refused the Dilantin, and then report it to the. First, you're going to report it to the charge nurse and let her know. But remember, you're going to circle it on the MAR, on the front of the MAR, turn to the back of the MAR and put a comment, resident refused Dilantin. You're going to put date, time, and initial. Then you're going to come to the progress note, and then you're going to here say resident refused Dilantin despite multiple attempts. You have to show that you did try many times. So Nurse David was made aware, gave instruction to monitor resident for seizure. Signed Donald Trump. So your delegating nurse says to you, okay, monitor the resident for seizure, because if they refuse their seizure medicine, the next thing that's going to happen is they're going to have seizure. So you don't want the resident to have seizure at the table and fall off and have an injury. You want to either you go sit next to them or you bring them to sit next to you. Okay. Now, let's say before you go home, you did monitor for seizure, and there was no seizure by the time you left. So you're leaving and you're handing over to the incoming CMT. Before you leave, you're going to put your note to show that you did monitor the resident and there was no seizure as of the time you left, in case something now happens later. So now at 3 p.m. you're leaving. Let's say your shift is 7 to 3. You're going to say here that, again, you're going to put the dates and time again. Resident had no seizure at this time. Incoming CMT made aware of resident's refusal of Dilantin. So you're going to give a report to your incoming CMT so that they know that the resident did refuse Dilantin and that the resident was being monitored for seizure. Okay. The last example we have here is an example of the discontinuation. So let's talk about that. So here on the MAR, let's assume, it's just showing you how to discontinue medication. Let's assume the doctor called and say, stop this medication. It could be that a lab work came in and showed that the medication level is already high in the blood, and the doctor doesn't want it to be toxic, higher than it is already. So the doctor will call and say, discontinue such and such medication. The doctor will also fax a written doctor's order to cover you and to cover him, that you're going to put in the medical record of the resident to show that the doctor wrote the order or gave the order. But you will stop giving the medication immediately. What you would do is to come right in front of the medication, discontinue. You're going to write discontinue in front of it, and then the time and dates that it was discontinued, and your initial to show that it was discontinued. Then the next thing you're going to do will be to go, go to the progress note and say of the resident and say right here. So on the 11th at 4 p.m. Dr. Smith called and gave order to discontinue. Dr. Smith called and gave order to discontinue amlodipine. Order was also faxed in. Then Nurse David made aware. You always have to keep your charge nurse informed of anything that is new. Anything that is happening, you must let your charge nurse know so that they also can do their part, which is to also communicate any changes to the family. Okay? To the family. And then communicate to the doctor. All right? And also just to be aware that, something happened. So those are some examples. I wanted to show you one more example, but I didn't write a report on that one. But this is an example of a hold. Let's say the medication was not discontinued, but it was placed on hold. Let's use this example here. So the Dilantin, say you get a call on that 11th from a doctor. Doctor says, this is different from discontinuation. Discontinuation means you stop the order completely. Order is no more good. But sometimes the doctor just wants you to skip a dose or 2 or 3. So in this example, doctor says, hold the next 2 doses of the Dilantin. Let's assume, let's just say the 8 a.m. was given. I use this circle to demonstrate a refusal, but let's just say it was given, and say right around 12 noon, doctor called and say, don't give the next 2 doses of the medication, but continue after that. So that means that the 1 p.m. and the 5 p.m. dose will not be given. But then you're going to continue the next dose, which will be the next day at 8 a.m. All you're going to do is write hold and hold. Okay, that way when someone comes to give the medication, they're going to see medication is on hold, or in this case, medication has been discontinued. So what are you going to do next after the call? You're going to go to the progress note. You're going to put in the entry like we did before, put the date and put the time, and you're going to say, Dr. Smith called and gave order to hold the 1 p.m. and the 5 p.m. dose of Dilantin. If he gives you a reason, maybe due to residents' blood level being, Dilantin level being high, okay, then you're going to call your charge nurse and let the charge nurse know. You're going to write that also, charge nurse made aware. So those are examples of some documentation. If you have any question, write them down and then email me, text me, call me, and I will talk about it further. Okay.